Good day, dear students. Today we are going to talk about the hip bone. Now, what you can see, this is the hip bone of the left side. The hip bone is also called the innominate bone. Innominate means having no name, and it is called such because it is not assigned any other specific anatomical name. Now, the hip bones of the two sides along with the sacrum makes the pelvic girdle. The two hip bones are united together at the symphysis pubis, and the sacrum unites with the hip bone to form a plain synovial type of joint. And it is via this joint that the weight of the body is transmitted to the hip bone. Now, as you can see here, the hip bone is irregular in shape. Okay, it is quite irregular in shape, and it is expanded at its upper and lower end and constricted in the middle. It is constricted in the middle, and at the outer aspect of this middle constriction there is a deep fossa which is known as the acetabular fossa or the acetabular cavity. This acetabular cavity or acetabulum articulates with the head of the femur to form the multi-axial ball and socket type of hip joint. Now, below and in front of the acetabulum, you will be noticing a large oval or triangular foramen which is known as the obturator foramen. Now, the hip bone is made up of three bony components. The dorsal component is the ilium, and there are two ventral components, the ischium and the pubis. And these three bony parts, the ilium, ischium and the pubis, they unite in the floor of the acetabular cavity. Now, the three bony parts are initially separated by a triradiate Y-shaped cartilage, the stem of which is directed backwards, and the two bifurcated ends are directed forwards. So, this triradiate hyaline cartilage is replaced by bone around the age of puberty, and the three bony elements, ilium, ischium and the pubis, fuse thereby. The upper 2/5 of the acetabular cavity is formed by the ilium, the lower 2/5 by the ischium, and the anterior 1/5 by the pubis. Now let's discuss the bony parts one by one. First, let's start with the ilium. The ilium has two ends, the upper end and the lower end. The lower end fuses with the other two bones in the floor of the acetabular cavity, as we have discussed, and the upper end is expanded to form an elongated crest which extends from a bony projection which is known as the anterior superior iliac spine to a bony projection behind which is known as the posterior superior iliac spine. This sinuous bony crest is known as the iliac crest. As you can see that there is a change in curvature of the iliac crest at the junction of the ventral 2/3 and the dorsal 1/3. So, the iliac crest is discussed as having a ventral segment which is the ventral 2/3 of the iliac crest, and it is convex outwards and concave inwards. And it has a posterior 1/3, or the posterior 1/3 is also known as the dorsal segment, and it is concave outwards and convex inwards. Now, the iliac crest, as you can see, it has an outer lip, an inner lip and an intermediate area. This ilium, it has three borders, an anterior border. This is the anterior border which extends from the anterior superior iliac spine. Then there is a notch below it. Then there is another spinous bony projection which is known as anterior inferior iliac spine, and it ends at the upper margin of the acetabulum. Now, then you have a posterior border. The posterior border begins from the posterior superior iliac spine. The initial part is rough. It extends up to the posterior inferior spine, and then the posterior border continues as the upper and anterior borders of the greater sciatic notch. This is the greater sciatic notch. So the posterior border continues along the margin of the greater sciatic notch, and then it continues with the ischium. Now the junction of the ilium and the ischium is along the stem of the Y-shaped triradiate cartilage. Okay, so here the posterior border continues, posterior border of the ilium continues with the ischium, and this is the medial border. As you can see, the medial border, it is rough in the posterior 1/3, in the middle 1/3 it is very sharp, and in the anterior 1/3 it is rounded and extends up to the iliopubic eminence. This bony prominence is known as the iliopubic eminence, and it is roughly in the same plane as the stem of the triradiate cartilage. See? So, the iliopubic eminence is the junction of the ilium and the pubis, where this is the superior ramus of the pubis. It meets with the ilium at the iliopubic junction. Now there are three surfaces of the ilium. Between the anterior border and the medial border, you have the iliac fossa. Between the medial border and the posterior border, this surface is known as the sacropelvic surface, and between the anterior border and the posterior border, this surface is known as the gluteal surface. Okay, so the gluteal surface is at the back. Now let's come back to the iliac crest. At the anterior superior iliac spine, we have the attachment of the lateral end of the inguinal ligament, which extends from the anterior superior iliac spine laterally to the pubic tubercle medially. And below the attachment of the inguinal ligament, there is the origin of the sartorius here from the lower part of the anterior superior iliac spine. At the posterior superior iliac spine, you have the attachment of the sacrotuberous ligament. The sacrotuberous ligament extends along the upper part of the posterior border to the ischial tuberosity, to the medial border of the ischial tuberosity. It is oriented in this fashion. Okay. So at the posterior superior iliac spine, you have the attachment of the sacrotuberous ligament. Now let's come to the attachments of the iliac crest. First, let's discuss the ventral segment, and we are going to go from outside inwards. At the outer lip, you have along the entire iliac crest, we have the attachment of the deep fascia of the thigh, which we call the fascia lata. At the anterolateral aspect, this fascia lata is thickened to form the iliotibial tract. Now, just inside the attachment of the fascia lata from the anterior superior iliac spine up to this bony thickening, which is known as the tubercle of the iliac crest, we have the attachment of the muscle named tensor fascia lata. Now, please note that about 5 cm behind the anterior superior iliac spine, there is a bony thickening which is known as the tubercle of the iliac crest or the iliac tuber. Now, there is another term which we will come across later, which is the iliac tuberosity. Okay, so the tubercle of the iliac crest must be differentiated from the iliac tuberosity. So we were discussing about the attachments of the ventral segment. The tensor fascia lata is attached from the anterior superior iliac spine to the tubercle of the iliac crest, just inside the attachment of the deep fascia of the thigh or fascia lata. Now further inwards, we have the attachment of the external oblique muscle of the abdomen in the anterior 2/3 of the ventral segment. Okay, now then there is a gap, then there is the attachment of the latissimus dorsi muscle. Okay, so from the posterior 1/3 of the ventral segment. Further inwards, if you go inside to the attachment of the external oblique muscle of the abdomen, which is also called obliquus externus abdominis, its Latin name. Then we have the attachment of the internal oblique muscle of the abdomen, which is also called the obliquus internus abdominis, along the entire length of the ventral segment. Then inside to the internal oblique muscle of the abdomen, we have the attachment of another muscle known as transversus abdominis in the anterior 2/3 of the ventral segment. Okay. In the posterior 1/3, we have the attachment of the quadratus lumborum muscle. This quadratus lumborum muscle is covered anteriorly by the anterior layer of the thoracolumbar fascia and posteriorly by the middle layer of the thoracolumbar fascia. Then further inside, inwards, we have the attachment of the fascia transversalis along the inner lip. So along the inner lip, we have the attachment of the fascia transversalis and then the fascia iliaca. Okay. So once again, the attachments of the ventral segment of the iliac crest at the anterior superior iliac spine, we have attachment of the inguinal ligament and the sartorius muscle. Along the entire outer lip, we have the attachment of the fascia lata and anterolaterally the iliotibial tract. Then just inside up to the tubercle of the iliac crest, the tensor fascia lata muscle is attached. Further inside from the ventral 2/3 of the ventral segment, we have the attachment of the external oblique muscle of the abdomen, and then leaving a gap for the base of the lumbar triangle, we have the attachment of the latissimus dorsi. Then further inside, we have the attachment of the internal oblique muscle of the abdomen. And further inwards, we have the attachment of the transversus abdominis muscle in the anterior 2/3 and the the quadratus lumborum muscle in the posterior 1/3, which is covered by the anterior and the middle layers of the thoracolumbar fascia. Then further inside, along the inner lip, we have the attachment of the fascia transversalis and the fascia iliaca. Okay. Now come to the dorsal segment. Along the outer lip of the dorsal segment, the fascia lata splits to enclose the gluteus maximus muscle. The dorsal segment is divided into an inner sloping area and an outer sloping area by a median ridge. To this median ridge, we have the attachment of the posterior layer of the thoracolumbar fascia, and onto the inner sloping area, we have attachment of the erector spine muscle, and to the outer sloping area, we have the attachment of the gluteus maximus, which extends to the gluteal surface of the ilium. Now, all these muscular attachments, these are origins, except the attachment of the external oblique muscle of the abdomen, which is an insertion. Okay. So, thank you for your patient hearing. We shall continue with the ilium in the next video.